Welcome to House Calls. I'm Jessica Salazar. I'm the Director of Marketing and Public Relations here at Overland Park Regional Medical Center, a part of HCA Midwest Health. Spotting a stroke is the first step towards stopping it. Today, we are speaking with Lindsay Underwood, stroke coordinator here at Overland Park Regional Medical Center. Welcome, Lindsay. Welcome to House Calls. So what exactly is, hi, what is,
Hi, thanks for having me.
You're welcome. What is a stroke?
So a stroke is just a lack of blood flow to your brain. It can happen because there's a clot or a large mass that is blocking that blood flow within an artery, or it can happen because there's a bleed inside your brain, which means that the blood flow is then not actually feeding the parts of your brain it usually does.
So what are signs and symptoms of a stroke?
Here at OPR, we teach be fast. I know a lot of you are familiar with fast, but I want you to think be fast. And stands for balance. It is the number one miss sign of a stroke, but if you feel dizzy, uncoordinated, and with stroke symptoms, like we said, it's that lack of blood flow. So this is going to be a sudden onset. So a sudden onset of balance or dizziness, that's the B. E stands for eyesight, so double vision, blurry vision, maybe missing parts of your vision. F stands for face. That's the most familiar one, right? You tell someone to smile and they go like this. Only one side of their face moves. A is arm, weakness, numbness or tingling on one side versus the other. S is speech. This can mean you have slurred speech, garbled speech. Maybe your words aren't coming out correctly or you're not able to get your words out. And T just stands for time. We want you to call 911 right away.
Are there risk factors for stroke?
Yes, and the number one cause of a stroke is hypertension. So it's very important to you go talk to your primary care physician, have your blood pressure checked. If you're taking medication for blood pressure, take your medication, but also see the prescriber frequently enough to make sure that it actually is working. 80% of strokes are preventable. So go to your primary care physician and ask them, what are my stroke risk factors and how can we treat these?
So we're seeing a trend in people delaying ER care due to COVID-19. Why is it important to get to an ER at the first sign of symptoms of a stroke?
Time is brain. Please, if you have any of those stroke symptoms, come immediately to the ER. They actually say every delay in 1 minute of care is actually 1 week of disability. So when that blood flow stops perfusing your brain, those brain cells start to die. And our goal is to reperfuse and to get that blood where it needs to be to bring as much brain back to life as we can. So every minute you delay, you're adding on a week of disability. So get to the ED as fast as you can.
What happens once a patient is brought into our ER?
Well, we take stroke care very seriously. Around here, stroke ain't no joke. So we are going to bombard you with our stroke team, and they're going to do a rapid stroke assessment on you. We have our neurologist who beams in from a bot, and they have so much stroke experience. They will do a stroke assessment. We'll also take some lab work, and we're going to do some imaging of your brain, and we'll analyze the results from all of those things to decide your care of treatment.
And what types of treatment do we offer here at Overland Park Regional Medical Center?
Great question. So after we do that analysis, when you come in for a stroke, we'll decide whether or not you're a TPA candidate. And what that is, it's also a medication also known as alteplase, but it is our clot busting medication. So if you have a clot, like we talked about in that type of stroke, and you fit the parameters, we can treat you with that medication. And then we will also tend to your care throughout your stay here at the hospital. We also have neurologists on site and neurosurgeons on site should you need any of those.
So we are a certified primary stroke center. What does that mean and why is that important?
It's important because being certified means the Joint Commission comes in and regulates us and makes sure that we are delivering great care and the proper care. So you want to know that, right? You want to know that we're giving the best care that we can give. Primary means that when you come here, you can stay here. We deliver a lot of the stroke care that is available. There's a few things that we can't do, but most of your care will be held here at OPR and that we are monitored and certified to give it
And RER is a safe place. Can you talk about some of the precautions that we are taking in our ER for stroke patients and for just patients that come in to make sure that this is a safe place to receive care?
You know, HCI have been so impressed with how they've handled COVID and this virus and this pandemic. They have been on top of it before I think anybody else recognized that this could be an issue. And we take such good care, not only of our staff, but of our patients. Every single person, so staff members, visitors, patients, every person who comes into this hospital is screened. We do temperatures, we give everybody a mask, and we also have a special COVID screening that we are updating constantly as research is coming in. You know, we're learning something new every day about this virus. We're updating our screening process, and we make sure that we take all precautions to ensure the safety of our patients and our staff.
And how are we supporting our stroke survivors and their caretakers?
Great question. This is huge. Stroke is not a day-to-day thing. It is a month-by-month thing. And it is important that our survivors feel encouraged. And here at OPR, not only do we recognize a stroke and treat it well, but we really want to set up our stroke survivors for success, because it is a marathon, not a sprint when it comes to healing. And we have a stroke survivor support group. We meet the second Tuesday of every month, and it's in a little conference room right by our cafe. Now, we're currently not meeting in person, but I'm hoping that's coming soon. And if it doesn't, I'm going to find a way for us to meet another way. But we want you to know that you're not alone. So it's for stroke survivors and caretakers. It is it can be hard and challenging road. And oftentimes there's lots more obstacles to it than we think. And we want you to know that not only did we give you great care here, but we want to set you up for success long after you leave OPR, because we do care about you and your success of the program and all the other great things that we offer here.
Lindsay, thank you for your time. This has been great information regarding our stroke program. You can learn more about our stroke program at oprmc/stroke. Thanks for joining House Calls.